Spotter set 4 for MD final practical. Already 3 spotter set have been uploaded. Since the exams are going to happen in next 3 or 4 days, so I added few more slides together in this particular video only. We will change the slides every 10 or 20 seconds. Whatever the doubts you are having, clear it out before your exam. Again ECG, EC1, okay, diagnosis, sawtooth appearance, flutter. The second ECG, again describe the finding on this ECG, what is the diagnosis? Go through it. I hope many of you might have got the diagnosis. Those who didn't pick the diagnosis, pause the video, try to focus, and I am going to tell which are the area to focus. Pause the video and try to find the answer. Take a focus on this long lead 2. Look at the P waves. What is happening to the PR interval? So I hope now you have found. Hot block, what degree and all, you study it out. So again another ECG, findings and what is the diagnosis. Go through it, try to make the finding. The clues over here is, look at the lead AVR, look at the R wave progression, and look at the axis. The follow-up question might be how to differentiate between dextrocardiac and wrong lead placement. Diagnosis, I hope you got. Dextrocardia. Describe the finding on this ECG and what is the diagnosis. Go through the ECG and try to make it bundle branch block. Another DD could be, look at here, S1, whether T3, Q3 is present or not, you can make it out, but it is right bundle branch block. Regarding this part also, just to focus over here, even though the Q waves are not deep, but it is looking like S1, Q3, T3. So what is the diagnosis? And right bundle branch block. If that is not correct, you can, if the third lead is showing Q wave clearly, then always think of pulmonary embolism. This is a tricky ECG. You have to see the findings. Suppose if the examiner is in real time asking the question, if they give the clinical scenario, you can make it out. Chest X-ray. How to read the X-ray? Positioning, penetration, hर बार पूछ रहा होगा. And another finding, pneumothorax. What would be this patient presentation? And what could be the treatment? ICD or putting the tube in the second intercostal space. Immediately, that is for tension pneumothorax. For a normal pneumothorax, you can see. And if you are answering all other questions very well, probably they might ask you how to calculate the volume of this air. Is there any formula? That kind of question you might encounter. The next one, NCCT head, subdural hematoma. They might ask you to differentiate with extradural hematoma. EC1, how would you treat this patient? Next is Porter. What is the finding? What is the diagnosis? Since your exams are 3 days away, I can tell you it is a aortic dissection and aortic calcification are seen. Probably this image might be an institute specific one. They might not keep this if that particular CT is not available. Suppose if this comes in the spotter, you can say dissection, aortic dissection. What is the finding? What is the diagnosis? What is the drug of choice? Small calcification, neurocysticercosis. Drug of choice for treating this condition, study. Neurocysticercosis. Again, this might be institute specific, or I think this image was taken from NEGM. Might not be kept in your exam, but if you want to know, the answer is neurocysticercosis. Identify instrument. What are the precautions to be taken before and while performing the procedure? So what is this? In the Google image, go and see lumbar puncture needle. The one that we are using of plastic and the needle is being in the plastic syringe. Previously, it used to come in the steel syringe. So go through the images. Don't confuse between bone marrow needle and the LP needle. So go through the Google image for LP needle and look at what are these uh, structures, how to differentiate between a bone marrow needle and a LP needle, lumbar puncture needle, and what is the name they give for this one, what is this one, what is this one. Suppose in that particular institute, only the plastic are currently being used, that yellow, black blood LP needle are there, only they might be going to keep that. What is this instrument? Name some indication for its use. I'm giving a gap of 10 seconds. Look at the instrument. Did you make the diagnosis? Diagnosis? Bronchoscopy. Indication? What are the indications of bronchoscopy? You can make it out. Again, another needle. Try to see all types of bone marrow biopsy, bone marrow aspiration needle, and the LP needle. Don't confuse it and say it in the exam. LP needle को bone marrow aspiration needle करके. So see the vintage type of these LP needles or the bone marrow needles and how to differentiate and all. See that. Identify this device. Name some complication of the procedure. Peritoneal dialysis catheter, curved one with two cuffs. What is the mechanism of action of this aliskiren? What is its dose? Aliskiren. What is the mechanism of this drug? Abatacept. Name some condition for which it is approved for use. A rare drug, probably to select a very good performing student from the average one. So these kind of googly kind of question might also might get. Abatacept, and the name one condition which is used being approved for use. Third drug, rivaroxaban, mechanism of action used for and the dose. Another drug, mechanism of action used for dose. Liraglutide. In all the spotter set, this question is always there. Liraglutide. Identify this lesion. Name some conditions in which it may be seen. I hope you might have made the diagnosis. This is spider navy, most commonly seen in CLD. Other DD, study it out. Describe the physical finding. What is the name given to this appearance? Name some condition in which it may be seen. This is the axilla darkened. Acanthosis nigricans. Rest you study. Describe the physical findings. What is the name given to the appearance? Name one condition in which it may be seen. Clubbing. What is differential clubbing? I hope you might be knowing differential clubbing. Study that. Name few condition which is associated with this. Describe the physical finding. What is the name given to the appearance? Name some condition in which it may be seen. Erythema nodosum. Condition in which seen. Erythema nodosum. I hope you know the answers. Describe the physical finding. What is the name of this lesion? Name some condition in which it is seen. This is target lesion. Erythema multiforme. Rest. I hope you might be knowing the answer. You might have studied from the Kundu in the dermatology chapter. Erythema multiforme. All the details is clearly given over there. Then last few questions are related to the formulas. What are all the kind of formula related question you might expect? I'm not going to read it out. I'm going to keep the slide for 10 seconds over here. I'm going to switch to the next slide. Next is water. Again, some kind of calculation related FeV1 by FeC. What are all the diagnosis possible with these values? Try to make it out. All the four values are given. So these kind of FeV1 and FeC related questions might be there. Simple ones to differentiate obstructive and restrictive kind of lung disease. Then ABG related stuff. Anion gap. What is the acid-base disorder? What is the most likely diagnosis? Anion gap, sodium plus potassium minus bicarbonate minus chloride. So based on this history, you have to make out what is the acid-base disorder the patient is having. Another acid-base disorder question, ABG related question. A 26-year-old lady brought to the casualty with a history of consuming compound used in rat killer. Potassium is 2.1. So the questions are, what are the changes likely to be seen in ECG? What is the compound? How would you treat this patient's hypokalemia? Finger lactate potassium content, 1 ampule potassium chloride. What is the potassium in milliequivalent? What is the fluid which contains maximum amount of potassium? These are the questions you should be aware. The rest you can make it out. Again, one clinical scenario kind of question. Where is the lesion? What structures are affected? What is the name given to the constellation of finding? Something related to child puke score and regarding management of the ascites. Probably SAG related question will be asked. Serum albumin ascites gradient and the related question. So go through the values. So something related to child puke score might be there. And what are other calculations which can be asked is curve 65. One other scoring system they are asking for severity of pneumonia. There are so many scores. You can answer one or two scoring system which is being used. Another calculation related stuff is ABCD score. How will you treat this? Go through the history and try to make out the answer. Okay, this completes set 4 where I added few more questions. Not only 10 questions kept, now we have kept around 20-25 questions have been kept, I guess. Only 2 more slides are yet to be uploaded. Rest I have uploaded. As I am the final year, I hope you are knowing the answer for majority of the questions. And next two video I will try to upload by today night only if possible. Otherwise before day after tomorrow max I will upload all the spotter related stuff.